We're going to go through a few questions. First of all, Dr. Lynn, who should ask their physician or who should consult with their physician before taking this product or work in tandem with their physician? Not that they can't take it if they're on antidepressants, but it should be, done with oversight of a physician, right? Anyway, just dive into this. Who should consult their physician before taking this product?
Well, first off, obviously, if you're pregnant, probably wouldn't recommend this product. People who are already on antidepressants, you really should speak to your physician about the fact that you're going to be on something that can raise serotonin, norepinephrine, and dopamine so that they're aware, there could be some interaction there. People who are on stimulants already, so someone who might be on Ritalin, Adderall, you're probably not going to want to add this Elevate on, or maybe do it cautiously again with the guidance of your physician. They found in clinical studies that tesofensine, it can raise blood pressure, not a whole lot, maybe 1 to 3 points. So your systolic blood pressure might go up by 1 to 3 points on average. What they found is that the higher the dose, the more it affected blood pressure. So at the dose that we have our Elevate at, the 0.25 milligram tesofensine, usually you don't see much with blood pressure, but once you get up to 1 milligram, that's when you're going to see a little bit more. All three doses, when they were looking at the studies, a 0.25, a zero point 0.5, and the 1 milligram, all three doses did raise heart rate. So that is something that I kind of noticed the first few days where my heart seemed to be beating a little bit more faster, a little bit stronger. So it may raise your heart rate by about 7 to 8 points, where it probably isn't a big deal for most people. But if you're already somebody who has atrial fibrillation, tachycardia, high heart rate, or if you're very aware of your heart rate and it makes you anxious and it goes up a little bit more, you may feel, a little strange or more anxious if you're really feeling your heart. So I do want people to be aware of that. And then the other thing to note is that because of its very long half-life, I do recommend that everyone just go ahead and start with 1 tablet per day
Yes.
because it does build up on itself. What you're feeling on day 1 or 2, just that kind of mental clarity that's improving, that's probably more the dihexa that's doing that. And then as you start taking it, more days, you're going to see enhanced effects from the tesofensine, the serotonin, dopamine, norepinephrine starting to go up. And so you might not think it's doing anything for you the first few days, but then after being on it for a week, you might say, wow, okay, 1 tablet is enough. So if you are going to go up to 2 pills per day because you want to see more of the food noise go down and you'd like to see the weight loss, more robust weight loss, at least wait a week and then go up to 2 per day. Now, if you're going to split it twice a day, just be careful because the product can affect your sleep in some individuals. So the biggest side effects that we see from this: dry mouth, insomnia, nausea, headache, constipation, diarrhea. Those are some things that are really real. That's what they saw in clinical studies. But interestingly, there were very few people who dropped out of the study because of the side effects. So, most people.
Manageable, like manageable. And if you are someone that has a little bit of a sensitive stomach, which incidentally I am, and I didn't have any difficulty taking it on an empty stomach, but you can take it on a lightly fed stomach as well. And then would you say there's an adaptability, which is why start with one, let the cumulative benefit of one really sink in, saturate before upping the dose and definitely get a sense of what this product does on its own. But is there an adaptability? It seems like in the things I've read that you may have some like the things you mentioned, your heart might feel like it's beating a little faster or whatever. So
So eventually, you probably will get
level
used
out.
to, you'll level out. What's interesting too about tesofensine is that you may feel after a while, if you decide to be on it for longer, you may find that it doesn't stop your cravings as much as it used to. But they found in the studies that even if your appetite wasn't as suppressed, you did not see the rebound weight gain. So that I thought was interesting. So there may be a little bit of a thermogenic effect. Maybe it increases your metabolism a little bit. Calorie expenditure, especially at night, is what I've read. So that was interesting. And then the other thing is if you are taking this, let's say, more than a month, and you decide to get off of it, you really should not just stop it abruptly. I mean, the nice thing is that because it has such a long half-life, most people won't go into, a withdrawal right away. And maybe most people would do fine because it gradually gets out of your system. But for people that are used to having higher levels, they get used to having higher levels of serotonin, norepinephrine, and dopamine, and then all of a sudden it's not, as high. People may notice that they're more irritable, that they're more tired, that their mood isn't as good as when they were on Elevate. So it's just something to be aware of.
They're both body and this are 2 months on, 1 month off. If you start with Nueva Body and you're getting that metabolic pathways and all of that foundational stuff, the cellular level stuff handled, and then you add this in the off month, that is one way that it works brilliantly. And then you took Elevate on its own and then gradually moved into taking it along with Body. And I think there are a number of people that are successfully doing that. Let's talk about ways to use this with the other products. You had a great idea that you shared with me the other day about maybe starting them with Elevate, depending on what their needs and their issues are. When you're talking to someone, you can ask the question, in your weight loss, like if weight loss is what they're targeting, right? If in your weight loss journey, why have the other things you've tried not worked? And if they throw in, well, because I just can't stop eating my carbs, or I've so my late night cravings, or I just need my sugar, you know to start them with Elevate as long as they're not on, antidepressants or they don't have a heart condition, then you know to start them with Elevate. If they don't mention anything about the food noise, then maybe you start them with Body and lead them to Elevate. So share just your idea about the 20-day thing that you mentioned.
What I've created is kind of like a quiz where I try to figure out what is really impacting someone's health goals. And for a lot of people, if it's, they can't even think, they're so stressed out. All they think about is food all day long. They're not going to be able to have that low inflammatory environment that you need to really start to heal. And so I would recommend that you start with Elevate first, just to remove all the quote toxin.
Roadblocks.
Yep,
Yeah.
roadblocks, the food noise, the bad stuff, processed foods, that type of thing, sugar. Again, my recommendation would be start with one a day for a week, and then you can increase it to two a day. If someone feels ready, their mind is clear, everything just feels like they're settled, they've started making changes in their diet, they're starting to, move more, then at that point you could transition without continuing on with Elevate. You could transition into Body at that point if it feels like they're ready to do that. But some people they still need the support of Elevate before they go into Body. Now, if you have somebody that they don't have issues with food noise, they're barely eating, because I have a lot of those patients
Yeah.
where
Yeah.
they're over the age of 60, they're not moving, they're not exercising, they're tired all the time, they're complaining of brain fog, and it's not like they're eating terribly. Those people, I start on nitro and body. It's very different how you start. And, I was really thinking about the utilization of these tablets, how easy they are to dose. And I was thinking how awesome of a tool these can be for someone who's a health coach, a physical trainer, people who have clients, some type of wellness practice where they don't have the ability to prescribe injectable peptides. This becomes a really nice way where they can do everything that maybe a prescriber such as myself, I prescribe injectable peptides and other things. But if you don't have that ability, it's so nice to be able to still coach your clients, be there for them, help guide them versus, right now there's so many programs with the hims and hers and rows and that type of thing where
Yeah.
you're handing off your clients to someone else to manage the medication and with the injectables and that type of thing, which, I personally, I don't like it when my own patients are doing that.
Yeah.
I'd rather be managing them myself and supporting them myself. So if anyone knows of a wellness coach, trainer, that type of thing, who would love to be able to bring this into their practice with the coaching and then having these tools to help, curb the cravings and the food noise, and then also empower them to change their habits and just change the ways that they've been doing things. I think these could be really, really good with a holistic type of program.
Let's talk about the importance of the lifestyle things. How important is it to make sure you're getting your sleep, to drink water, eat high protein, exercise, move the body? Like, why is that even increasingly important if you are going to supercharge your body with these performance products that will up level you?
Again, we talked about the importance of the gut, and your gut bacteria, they're what's helping you make these neurotransmitters. And so you can, even with the Elevate, trying to raise your serotonin, norepinephrine, dopamine, unless you have the building blocks to make them, which is eating an adequate amount of protein. The Elevate's not going to work as well as it could. So you have to eat the right type of diet that supports these peptide products. You want to make sure that you are getting at least 30 grams of protein per meal. So that's, just the basic, how much protein you need. And then the other thing that I tell my patients, I like to see 1.6 grams of protein per kilo that they weigh. Okay, so you take your weight in pounds divided by 2.2, and then you times it 1.6. If you have someone who's very, very active, then I might even do 2 grams per kilo. Okay. And then the other thing that you're going to want to make sure that you do is get enough fiber. So I like to recommend 30 grams of fiber. Fiber is wonderful. It helps to feed the healthy bacteria in the gut. And speaking of bacteria in the gut, I also recommend to my patients that they should be doing fermented foods, ideally 1 to 3 times per day. So some simple things. Would be kimchi. You could do sauerkraut. You can do kefir. Those are some of the fermented type of foods, and it's really easy to incorporate into your diet. And I've noticed instead of my jelly beans, I'm eating sauerkraut. So in the
Oh,
evening, that cuts the appetite.
it's true.
Works really well. And so you're getting the good gut bacteria. You're feeding the bacteria with the fiber, and we have some amazing products in our with the Nueva products with the Snow Slim. It has prebiotics and fiber, and we see that too with the Snow Collagen that also has prebiotics with the chicory roots. So that's really good. And then movement, of course. So 30 minutes
Yes.
some type of movement is important. So for me, I tell my patients it's a 30-30-33. People need guidelines
Yep.
and they like numbers. And so if you can give them something really easy to focus on, it's going to just help their outcome, their results.
Let's talk about how this works with GLP-1s. Once again, very interesting because they work with different mechanisms where the GLP-1s are dealing primarily with, emptying the gut and all of those things. This is dealing with the brain. And, so they're different. I'll let you speak to, can they be complementary? What are your thoughts on that?
Yeah, so if someone's on a GLP-1 and they've reached kind of a plateau in their weight loss and they're not really noticing that the GLP-1 is helping with the food noise, you certainly can add Elevate to that. I know right now it's really popular for people to be microdosing the GLP-1s, which, clinically, studies don't show that they help you lose weight, but I mean, I'm sure some people do notice it. But if they're microdosing for other reasons, not for weight loss, and they're kind of upset that they're not losing weight, I mean, these are the perfect people that adding Elevate would help them reach their goals.
What if someone does not need to lose weight, but they want the cognitive benefits? You just have to be mindful that you eat because you will feel more satiated and the food noise will,
Mhm.
if there ever was any, will be gone. You'll have less tendency to eat. You need to be conscious that
Right.
you're eating.
And,
What
and in the studies, it was interesting that tesofensine did not affect the normal weight animals as it did the heavier obese ones. And so if you have more weight to lose, you're going to see much more of that weight loss than someone who's already a normal weight. If you don't have that much fat on you, you're not going to see as much weight loss. So I don't think we need to worry about people all of a sudden uh,
wasting away because
wasting
yeah,
away. But
yeah,
I mean, you definitely want to be mindful of your dosing. If you're already thin, you probably don't want to take two Elevate per day. And you want to follow those rules about eating enough protein, getting enough calories, and that type of thing.
yep.
Yeah, I mean, I didn't
Jump in, Tina.
and I do not need to lose any weight, at all, because I think being strong is more important,
Yes.
sort of thing. So and like I said, yes, I was like, whoa, I think I can see my abs, but it was an added bonus. It wasn't,
It
anything
wasn't
like
a
that. And
requirement.
I don't step on the scale at all. I just measure by how I feel. And so, after Christmas, I'm a little fluffy. And the best part about being somebody who really prioritizes, regardless of whatever supplementation you're using, you cannot let go of the pillars of hydration, the pillars of nutrition, where you're prioritizing protein, especially in midlife, right? And the pillars of movement.
Yeah.
So I also feel that these peptides are so amazing, but they are another tool. They're
Tools.
another pillar we can add to that set of three that I'm very, very passionate about, especially for midlife women, because so many people, like you said, Dr. Lynn, do not eat enough. Teaching people how to eat whole foods, eat real food, don't eat boxed food. Your life will change just from that. From that, you're going to lose so much inflammation, staying away from seed oils, all those sorts of things. And then being able to replenish what is depleted as we reach midlife and go through that transition of perimenopause and menopause and postmenopause. And of course, men are going through a transition too, as well, right? In regards to hormonal health. So I think what's super important is that we look at these peptides as like the ultimate tool, because up until now, we've just utilized, vitamins. You're choosing your B12. I mean, D is a super important vitamin. It's considered a hormone. It's, nowadays in medicine because it's so important. And magnesium so important, collagen important, but there's a lot of things that are happening that people are utilizing. We can take over with peptides.
I just looked in the chat to see if there are any questions popping up and they're going, preach it, Tina.
Yeah,
Um,
it's
honest-
true.
we really could go on and on, but I have already shared how I'm
Mhm.
going to, the questions I'm going to ask to determine what's the best path. How are you, Tina, going to determine whether you start someone with Elevate or you start someone with Body?
I think the most important thing is to obviously, you should say, if you're taking any sort of prescription medication, it's very important to run that past your healthcare provider, right? Nobody as a social marketer should be determining what people should be utilizing as far as supplementation when they're using prescription medication. But I will say that we know, and we've already been informed, and you've taught us, and Dr. Lynn has taught us so much tonight, that there are certain medications that we really need to like take off the
An eye
table.
out for, yeah.
That's right. And so I'm going to be asking, especially my menopause community, because there's 64,000 women in there, and a lot of them have been prescribed antidepressants, right? I mean, it's one of the common things that happens when you go to your doctor and you're feeling so crappy, you don't really know what's happening to you. And that's one of the things. I will definitely say, if you want to utilize the Elevate, you're going to have to run this by your doctor. But I can recommend the Body in regards to cellular health and increasing the RNAD, blocking the NNMT, being able to restore some of our fat metabolism, hold and build lean muscle. I feel safe doing that. I feel confident doing that.
Mhm.
So I love the fact that we have the two. For my more experienced people in my community that are already utilizing Body and loving it and have no other health issues, or they've been traveling this really great journey, I'm going to recommend to them that they, on their month off, try the Elevate. Then
Yeah.
they can determine which one they want to choose. And if they want to take both, they can. But I mean, that person's going to have a, like, you know, a nice, a nice
Bionic.
supplement budget. I
Yeah,
don't know.
and a
But
good budget. Yeah.
listen, peptides are expensive. And once the real world understands, our peptides aren't expensive.
No, they're not.
All peptides, people can go to Walgreens and buy a vitamin for $14.99. So when you're introducing them to something that's so far advanced, as far as, like I said, it's performance and regenerative wellness technology is what we are sharing with the world, they're going to realize it in a year.
Yeah.
I'm
Yeah.
convinced. So I'm not
Yes.
worried about it. I'm
Yes.
just going to keep teaching people about it.
Yes, 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 same. We've got the gold, you guys, with the products that we already have, the products we've already brought to market, three that you're going to be learning about in Orlando, and this product Elevate, it's game changing.
Mhm.
It is genuinely a beast of a product, like just um going to have such incredible impact for so many people. And you've got it, and in if you haven't experienced it yet, within days you're going to be experiencing it and having your own testimonial. I've kind of recommended that if somebody's gone through their first cycle of Body, they've really accomplished an important foundational thing. If they're, say, a month into their second cycle, they cycled off, maybe they did beauty, maybe they do beauty all the time anyway, and they're a month into their new cycle with Body. Would it work to just pause on Body? Because we have a good foundation now for a couple of days to be able to try the Elevate and to jumpstart. How would you recommend that kind of cycling?
I know everyone's going to be receiving their Elevate and they're in different, um, parts of their cycling on or off. And so I think that it'd be a really good idea just to get off the Body for at least a week and just try Elevate on its own, just to really know what it does for you. For those people who, might not want to take something every single day, again, going back to the long half-life, I do see this as something that people could do for maybe 1 to 3 weeks at a time, just cycling in and out using these products because it takes a while to ramp up and it takes a while for it to, ramp down. So even if you did one a day for a week, then maybe two a day for the next week, and then one a day for the third week, I think that would also be a nice way to cycle it. I mean, people will just have to kind of play with this. It's the nice thing is that the abuse potential is there. There's no abuse potential. Okay, it's not a stimulant. It's something that I feel we
That reminder.
could use. Yeah, just if you're having some down days and you need to get motivated and you want to change your patterns, change your life, it may be something that you do for a week at a time, 2 weeks at a time. So that's the beauty of all these products is that you're in control. You know what's best for yourself. And I find my patients, once they start learning about how their body works, once they start to develop intuition about what works best for them for healing, they really take control of their lives. And those are the ones who are the most successful. And they're just living amazing lives because they feel like they're in control. And I just think the Nueva products, it puts the power in your own hands. You're not looking at a physician to help guide you. Although, I do think that
Although you
people
are a
need,
physician,
yeah, people need health coaches. People need someone to kind of oversee. That's why, you have your counselors and psychologists and that type of thing. Parents, we need someone else to help us stay accountable. So, but you'll figure it out. I think the more you experience, elevate, you're going to be able to figure out what's the right way to dose it.
at some point early on, you need to do Elevate long enough that you start getting the benefits. It won't happen overnight. Just like, like body really needs that 2 months of a foundation. Once you have done kind of that saturation dose with the Elevate, then you can intermix and decide what and when and how. But it takes time to get the benefits that we're talking about. Like you can't take one or two and think
Right,
that
right, right.
in it, right? Like yield the benefits. Once you have taken it and you've done a full cycle, a month or two of Elevate, then you can pepper in whatever, right, here and there, and even do them together. Many people, in fact, both of you guys are successfully doing them together.